Great. Welcome to everybody to this workshop 3.1, Preferred Practices of Participation, Inclusion and Human Rights of People Affected by NTDs. And let me say quite upfront that this workshop will be recorded. So if you're not happy with this, then you would have to leave this platform. But I hope that everybody is happy for this to be recorded. I'll start just with some housekeeping notes. And you will notice you have entered the workshop with your cameras off and audio muted. And so please keep this muted to keep your background noise to minimum. If you're invited to speak either during the plenary or during the group work, then please unmute yourself and switch on your video. You find this in the left bottom corner of your screen. We will have breakout sessions and you will be automatically by MYT be moved into the breakout groups. So no action is required from yourself. Once you enter the breakout group, then please turn on your video and unmute yourself so when you wish to speak. You will also then, after this time, be returned automatically back to the main room. And when you enter the breakout room, please note down your facilitators' names so that in case you drop out, that will help then MYT to get you back into the breakout room. Thanks to the overnight work from MYT, we have now chat facility also not only at the plenary, but at the virtual, at the breakout session. So that's very helpful. Thank you again to MYT for this. But for questions, and that's why this is important, for all questions, kindly use the chat facility that you see at the center bottom of your screen. And we will have discussions 15 minutes after the 4 presentations. And Zurich will very kindly keep track on those. And if we cannot address all your questions, either this will be done later when we go through the chat conversation, or you address it to the speakers, Mathias, Zurich, or myself, afterwards. Human rights-based, inclusive and participatory NTD work is really at the core of the disease management, disability and inclusion work and approach, including also our cross-cutting group, DMDI. And these are now, and we are very happy about this, explicitly recognized and reflected in the new WHO NTD roadmap. And further, the DMDI cross-cutting group developed an NNN statement on participation, and that is hopefully or expected to be adopted by the members at the final plenary session. And this is a very big and exciting step forward. We had a couple of DMDI workshops at earlier NNN meetings, and they were more focused on the conceptual understanding. So now, today, together, through this workshop, we want to really facilitate a decisive move from concept to practice, to action. And that shall be based on some very exciting presentations that present us with some preferred or good practices examples, highlighting important lessons learned. So we are very privileged to have a great selection of outstanding speakers covering a significant range of NTD experience. And based on these initial case studies and discussions, we will then have 4 breakaway groups to discuss and agree next and also importantly first steps. So before we start, let me just remind all speakers to strictly keep time of 5 minutes to allow for adequate discussion. So with this, let me introduce our first speakers. These are Javier Sancho and Jenny Sanchez. Javier is the coordinator of Global Chagas Disease Coalition, and Jenny is the vice president of Find Chagas. Over to you.
Martin, I'm not sure if Jenny has managed to connect yet.
We could
what
move
about
this
if we,
around? Yeah.
What if we
can
start with Gail?
Yeah, so let's start with the second presentation. We had some technical issues. So we start with Gail Davey and Fikre Helikiros. Gail is working with footwork and is a professor of global health epidemiology at Brighton and Sussex Medical School and a previous much appreciated NNN chair. And Fikre is the executive director of NAPAN. So then with this, over to you, please. Gail.
Thanks very much, Martin. And I'm going to hand straight to Fikre to open our shared session on experience of developing patient advocates within the Podoconiosis network.
Thank you, Martin. Thank you, Gail. Hello, everyone. I'm Fikre from NAPAN. NAPAN is a consortium organization dedicated in the support of the National Podoconiosis Elimination Program. Today, I'm going to present to you on how we identify and get the patients prepared for advocacy. At the background, like many other entities, podoconiosis is found in remote rural settings. Those affected cases usually experience physical, social, and psychological barriers, mainly to participation. Most importantly, these people are less likely to have had formal education and more likely to be food insecure when we compare them with those affected ones. Next. So what experience do we have? Our perspective in identifying
Fikre, I can't hear you.
Fikre, it seems like you've dropped off.
Gail, otherwise, can you take over from here?
Okay, we had discussed this possibility. I'm really sorry. It's a pity he got off to such a good start. So NAPAN has been through its partner organisations identifying and preparing patient advocates for a few years now. And part of the process is identifying patients that understand the disease and the practices needed for self-care. Patients have shown progress by adopting self-care, and for podoconiosis, that's usually progress in terms of management of the swelling of the lower limb and reduction of acute episodes. They're also identified as people who can tell their story around the condition and the impact it might have had on them. And they tend to be people with a particular passion to support other patients, and particularly the housebound. Now, once the potential patient advocates have been identified, there's still a lot of work to do, and skills and business management. Then to strengthen their ability to hold and facilitate community conversation sessions, and then to equip really with adequate materials, because patient advocates are often involved in care of other patients themselves, and equipping also with messaging flyers to use in community-based awareness. Equippings at community level, And I'm now going to go on and sort of explain the other side of things from the point of view of Footwork, which is the global level advocacy body for podoconiosis. And I think it's absolutely vital that at this level, we're identifying and then creating opportunities for patients to participate. They don't just come along on their own. So it's very important, even creating them. Then it's obviously important to develop support, so resource in terms of language training, communication skills training, and then support for the travel, and then any conference fees, subsistent fees, not just for the individual themselves, but also for a supporter who can be at their side. And I suppose experience from Footwork shows that it's quite difficult to find budget lines often. And we've used research funding budget lines, including public and community engagement and dissemination budget lines. And then at times it may be important to do specific fundraising to support patient attendance at events or use unrestricted funds. And I think the main message that both of us wanted to put forward is that developing patient advocates is a very long-term process. It's not that something that happens overnight, but may take many months. Thanks very much. I'm now going to hand back to Martin.
Thank you very, very much with these relevant notes. You dropped a little bit in and out for me, but it could be my line and the Nairobi end. So I hear that now Jenny is on, so we can revert to the presentation one from Javier Sancho and Jenny Sanchez. Javier is as I said, the coordinator of Global Chagas Disease Coalition, and Jenny is the vice president of Find Chagas. So go ahead, over to you, Javier and Jenny.
Thanks a lot. Thanks a lot, Mathias. Thanks a lot to all the team that have been organized this workshop. This is the first time for Chagas disease to participate in a direct dialogue and in a workshop, and that is the good news. We are a little bit lazy and late, but finally Chagas disease is here, at least a little bit, and it's a privilege to me to have this dialogue with Jenny Sanchez. She's the vice president of the International Federations of Associations of People Affected by Chagas disease. Jenny, you have the camera off. I don't know if you can switch on your camera, maybe. You hear me well?
Good morning, Javier. Good morning, everyone. I can hear you well, but unfortunately my camera is not working. I don't know what's the reason.
Well, okay. So we are going to keep this short dialogue, Jenny. As I said, this is the first time that Chagas disease representatives are participating in the NNN Conference. My first question for you, Jenny, is you are connecting from the US, but you are from Bolivia, isn't it?
That's right.
So Bolivia, I need to remind that this is one of the most affected countries by this one neglected disease, one of the most neglected among the neglected, that affect mainly Latin American countries, but it is expanded to the rest of the world due to migratory movements. Jenny is in the United States, precisely. So what are the lessons learned by Chagas community about the participations of people affected? I don't know why and how this participation is so important for you, Jenny.
Javier, I think one of the biggest achievements for us as an international federation of people affected by Chagas disease is the network that we have been able to create around the world. Right now we are 22 associations that are scattered around the world. Just said, in the United States, and like myself, there are other associations America all the way down to Mexico and United States, and also others in Europe. And you mentioned also that immigration, and that's one of the things that it's been very helpful to all of us, because by having different people in different part of the world, we've been able to help each other, encourage each other, and help from each other.
Sorry, Jenny, I can hardly hear you because it is like it's sounds problem. Maybe you can come closer to the microphone, but I will use my headphone anyway. I would like to ask you also about the engagement of persons affected by Chagas disease. What kind of things have worked well according to your view, and what other things did not work so well in the organization between the different associations? Because I understand there are so many and in a very extended geographical extension.
Yeah, like I said, by having this network of people, we've been able to learn from each other and help each other. And that's the biggest takeaway that we can have from this. And also we have been able to involve other authors in the system. Like, for example, we're not only fully created by patients, but we are also joined by other people that have been sensitized and, by the disease. For example, we have in the team people that, like myself, that have been identified with the disease because first I have my parents that have the disease and my grandparents. So that's some link that I have with Chagas. But at the same time, when I immigrated to the United States, I found the necessity of empower people in making the disease known to others. So
let me interrupt you, Jenny, just because we have only 1 minute and really it's very difficult to hear you because the connection goes and back and it is very low. So it seems that there is connection problem with the audio and the connection. So let me resume that for Jenny, if you can answer in the chat, written could be very helpful, Jenny, to these two questions that I formulated to you. And in order that all the people knows exactly what you have said, and especially those that couldn't manage to hear you very well, okay? Is it possible to write the answers for you in the chat?
I'm so sorry.
No problem, no problem. So sorry guys, this is the first try that we that we made in order to include Chagas disease and a dialogue with patients and representatives. It's failed, but we promise next time we will do better. Sorry for that, but thank you for having us. We hope that in the next working group session we can participate better. Thank you.
Thank you so much, Jenny and Javier. And it's great to have Chagas on board. I think it's great for Chagas. It's great for the larger NTD community to also learn and share experiences. That's really helpful. Thank you so much. The next session would be with Suresh Dong, who is talking on persons affected by NTDs and people with disabilities. And Suresh is the program manager with the Leprosy Mission Trust India. Suresh, over to you.
Thank you, Martin. Thank you, everyone. I'm Suresh Dongke from the Leprosy Mission India. I would like to present about NTD and disability, and our focus is CBID, community-based inclusive development. Actually, I'm person affected by leprosy, and now I'm working with more than 2,000 people with disabilities. And just in the CBID, we focus 4 years back, we focus on community-based inclusive development, and we see that there are lots of success in that. So we work on 6 elements of CBID, and these are, can you go next slide again, please? We focus on that 6 elements of CBID. First is awareness, second is twin track approach, you can see on the screen, gender equality, empowerment, accessibility, and participation. So in this, what we did not ask anything separate. We did not demand anything separate for people with disability, but we work on whatever available with government, and just we want to link our people with disabilities in that. And we found that that was the great success for increase the participation and inclusion of people with disabilities. So for example, about any scheme or any policies of government, first thing that all people should aware about that. So they should have that awareness about that schemes and policy and where to go and how to approach. So we work on that. We work on twin track approach, like we work on both levels, like duty bearers and claim holders. So whatever we train the people with disabilities, what rights for them, same time we train government officials what they have to give or what they are accountable to give to people with disabilities. So we work on twin track approach. Also we take care of the gender equality, and we focus on that, because we see in India, in rural part of India, that people affected by leprosy and other disabilities are vulnerable, but women with disabilities are more vulnerable. So we try to link them also, and we work on that gender equality. Empowerment was the major component, like we form some community-based organizations like Disabled People Organization, Inclusive Farmers Club, Inclusive Children Parliaments, and that the people approach to the government for policies and benefits and schemes, and they avail that. Accessibility is the major component, like we take care of the physical accessibility as well as institutional accessibility, like the documents should be accessible for all, and that place should be accessible for all types of people with disability. And of course, we focus on participation, like if I say now that all people, duty bearers, that government officials they are inviting with written letter to our people with disabilities to attend the Gram Sabha meeting, which are that grassroots government forum, and that people are attending that Gram Sabha. So government is giving written letter to them and asking them to attend and give your inputs for village development plan. So like that, is not only participation for tokenism, but active participation we promoted, we work on that. And if you see that all these components that really help us, and now I must say that all people with disabilities from our area, they are accessing all the benefits, all the policies of that benefits or schemes of government, and government is providing them, but even they are providing with priorities. So we're not talking about only equality, but also we talk about equity, and we just try to find out where the gaps, and we fill that gaps. And I must say that community-based inclusive development really help to increase the participation of people affected by leprosy and other disabilities. And now we are working with CBM, and in that now we are scaling up in other areas also. So we are working with government, we are working with other like-minded organizations, and we are promoting this CBID concept to increase the participation and inclusion, and also of course that that will lead to claim their human rights. Thank you so much.
Thanks a lot, Suresh. I think this nice overview of the CBID approaches is really, really important. Thank you very much. And I think we can draw a lot from that experience. With this, we come to our last presentation by Alice Cruz on persons affected by leprosy during COVID-19. And we had the pleasure to already listen to Alice, who is the UN Special Rapporteur on the elimination of discrimination against persons affected by leprosy and their family members on the first plenary session. And it's our great honor and privilege to have you here, Alice. So over to you.
Thanks, Martin. I just hope my internet works because I usually have a lot of problems with the internet. So I'll try to be quick and let's hope it works. Well, first of all, thank you for the invitation. Thanks to Mathias for the invitation. Mathias asked me to talk a little bit about what could be considered a good practice in terms of participation of persons affected by leprosy during the COVID-19 crisis. I must say that I am not sure if what we have experienced fits the concept of a good practice. And probably I will address here some of the problems that the same process revealed. So, but I would like also to say that this process of participation was implemented by the Global Partnership for Zero Leprosy. And so this means bridging grassroots and national organizations of persons affected to an international conversation. The problems that I will identify here, the positive and not so positive results, let's put it this way, are very different from what would be a discussion on the national impact of the work of national organizations. I think they are, we have better results at the national than at the international level. So to start with, I would like to challenge you. It has been great to listen to the previous presenters and especially to Suresh, because what they are doing, linking community-based development to advocacy at the political level seems really important in my perspective. But I would like to challenge you. We talk a lot about training and capacity building. And I think that we, and when I say we, I am referring to NGOs, governments, intergovernmental agencies, also need a lot of training and capacity building to be able to listen and to fully understand what people are telling us and not expect that people speak to us in our own language. So, to start with, we have developed a consultation process at the Global Partnership for Zero Leprosy. Mathias is part of this working group. And we have made a lot of regional calls and consulted with national organizations of persons affected by leprosy, but also individuals that do not belong to any organization. Well, first of all, to say that persons affected by leprosy were very much willing to participate, but some were also very suspicious and asked us, so what is this for? More fundraising for whom? So this is an important question to bear in mind. And all of them asked us that such a participation process should lead to action. And this is a very important lesson from organizations, grassroots and national organizations. Knowledge is inseparable from action. And for us, many times they are different things, but not for people working on the ground. In fact, the knowledge that they had about the impact of COVID-19 and that they were able to share with us came from the fact that they were already engaging with the ground and looking for solutions. So knowledge is produced in this way, and I think we should also be more practical in that regard. Well, the consultation process allowed to map the impact of the COVID-19 crisis in a way that would be absolutely impossible to do if the organizations of persons affected were not engaged. In all the knowledge that we were able to collect came from them. So this is a very important lesson also. Without participation of organizations and of persons affected, it's very difficult to gather detailed knowledge, especially when we are talking about vulnerable populations, people living in remote areas where the state does not even reach. But one question that I think it's important that we all make ourselves, and that thinking about this consultation process, who spoke during these calls were mostly men. So women participated, had more difficulties in participating in the process. We didn't have any children speaking with us. Of course, we cannot ask children to participate through online meetings, but I think that we need to focus more and more in reaching out to women, children, and people living in poverty, people with no access to technologies, people who do not know how to read or write. And for that, we need to train ourselves to be able to reach them and to listen to them. So after this consultation process, in which we identified very well the impact of COVID, we also implemented a questionnaire to map the measures that were being implemented to respond to the crisis. And I am now making a round of calls with organizations of persons affected for the work of my mandate, and I'm also updating the data on that. And the data is that very little action was taken. So in a way, this process was very effective in mapping the problem, but was less effective in leading to solutions and to action. And if you recall that I said that knowledge and action is inseparable from the point of view of grassroots and national organizations of persons affected, this means that the process was disappointing for them. If for the Global Partnership for Zero Leprosy, this was a very successful process because it was the first time that the partnership connected with grassroots and national organizations. For grassroots and national organizations, the process did not end up as they would expect. So I think these are important lessons to bear in mind. Participation, what is participation? It's not consultation. Participation must not lead to the appropriation of knowledge, but must lead to the recognition of what people are really trying to tell us. And as I told you here, people told us that knowledge is inseparable from action. And so we still have the part of action to take care of. So what is participation? Participation is primarily self-organization. Self-organization needs to be made through a bottom-up approach and not a top-down approach. It must lead to autonomy, and it must be based on horizontal relationships between the different stakeholders. Participation is collective and not individual. So we need also to think about the representativity of spokespersons. And participation, as I told at the opening plenary, may need to be confrontational. It's not always about cooperation. But mainly, participation is inseparable from accountability, because participation must lead to the real capacity of influencing and determining action. So I would say that it's important for us all to think about all these issues. I'm going to finish. How do we need to train ourselves to ensure that participation is a bottom-up process, ensures the autonomy of persons who are engaging in these processes, and really leads to outcomes that are in line with what people need and wish. And I would like just to finish by recalling you how in South Africa, at the time of government denial regarding AIDS, it were the poor Black women, and I was there, I made field work there, that were able through collective organization, self-organization, to lead to historical change at the national level. So I think they taught us a lesson. People do not need to be trained to speak how we speak. People need to be empowered to make change in their own terms. Thank you. Sorry for the time.
Thank you so much, Alice. This is really enlightening, and maybe I can, just as I will ask you a question, I can just encourage people, participants, to post questions for the following Q&A session via the chat function. Suresh will then read them, and please indicate also to whom of the presenters you address them. Alice, if I may just ask you from my side to get this started, I don't know how conversant you are with the new NTD roadmap, which really is a game changer. There's a paradigm shift going away from disease-specific interventions to cross-cutting approaches, reflecting the whole journey through care, and has a strong focus on person and community. How do you think that this new roadmap can help in addressing this urgent call for really linking knowledge and action and making effective participation of people affected by the negative consequences of NTDs happen?
I think that most of all, we need to think how can we, it's very important to make progress at the theoretical level, but we need to think again, how can we make sure that policies or strategies are really implemented and are implemented in a way that reaches all people. For instance, I think that we have a problem, a very serious problem regarding being able to reach people in remote areas. So this requires political will, allocation of funding. And that is why also participation is so important, because in the end, if citizens demand their rights, and are empowered to do so, governments will need to reply. That's why accountability is so important. We need political will to implement these good strategies. And of course, I welcome very much the new roadmap, but we need to find the means to make governments implement them. I don't know if this answers your question.
No, it does. It does. And I think the government and community ownership are key to the roadmap, but I think they're key also to the approach that you really highlight here that needs to be considered. We do have a few questions in. So maybe Suresh, you can start, read those out for the respective speakers.
Yeah. Hi, Martin. There is one question by Mr. Ashutosh.
Suresh, you are on mute. You can't hear.
Sorry. Thank you, Martin. Actually, there was one question by Ashutosh from Maharashtra, India. He asked that what measures are taken under CBID to protect people affected by leprosy from rights violation due to stigma and discrimination at village level. And I already answered him in chat box only, and that I would like to just to explain on that. So we focus on the empowerment, like which we say that 6 elements. So we more focus on empowerment, and in that we focus on disabled people organization formation. So that people with disability and leprosy are there, they form the groups, they went like village level, block level, district level, and now they are doing advocacy. There are many successes that simple that bank people were not able or not ready to open the account of people affected by leprosy group. So this district level advocacy, the group did advocacy and they got success. Also we work on twin track approach, like we are working with people affected by leprosy to just aware them about their rights, but same time we are working with the community, we are working with the government. So these are their rights and they have to give. So we majorly focus on awareness, twin track approach, empowerment, and of course participation. I hope I answer Ashutosh ji. That was only one question from so far. There another question. Sorry.
So,
yeah.
so maybe I can ask you another question.
Yes.
You know, you have been focusing on leprosy initially, but you are in the process of expanding to the inclusion of other NTDs.
Yes.
And actually, we
Yes.
shouldn't talk about NTDs, but about persons, so people and communities that suffer from other NTDs. So what are the practical implications for this expansion? Because many in our community, DMDI community, come from a leprosy background. So by expanding to include other entities, what are the practical implications of that?
Yeah, actually this CBID is not only for leprosy disability, it's applicable for all entities. And like we are not only focusing on leprosy, but we are focusing on LF, we are focusing on trachoma, and these people also also claiming their rights. And we saw there are the participation increased with the help of these 6 elements of CBID. So slowly we are adding this, and now we are also working with NTD, with other entities, and definitely, hopefully, we will have more entities success stories on this, how they are benefited through the CBID elements.
Thank you, sir. So there's a question, I think, from Mathias.
No, the question was asked by Javier. The question was asked by Javier, how can we convince or commit health authorities to open more room for affected communities in the process of participation and not only consultation? The question was from Javier and
addressed to
Javier.
There is another question from Stan, not answered. There is another question from, sorry, yeah, Mathias.
Yes, I think maybe in some ways, I think a part of it was answered already. I think a big part of that is the advocacy by people themselves, but then there's also I think NGOs can have a big role in advocating, and international like the UN and so forth can also advocate. But I don't know if Alice wants to say something else to that question.
And Javier, you're muted. Or we don't hear you when you talk. There seems to be a problem with Javier's microphone. He's trying to talk to say something, but we can't hear that.
Shall we go ahead then? Next question, please, Martin.
Please go ahead with the next question.
There is another question by Shan. She's asking to Alice Cruz. She's saying that you talk about considering the representative of spokesperson. Do you have any tips for ensuring the representatives of people affected by leprosy, women, men, and children, are truly representative or justify their advocacy? So, question to Alice Cruz.
Should I answer, Martin?
Please.
Yeah. Yes.
Go ahead.
So, okay. Well, I've seen some questions, and one was sent to me privately, and I would like to answer that question too, because it's really important. Well, regarding Javier, I think I think we can convince governments to promote effective, meaningful participation of persons affected by showing them how much they need them. This, for instance, this particular situation of the COVID-19, after we had this consultation process, that allowed me, for instance, as special rapporteur, to send a letter to the governments explaining what was going on with persons affected by leprosy. So governments do not reach all places, and their knowledge is very limited when it comes to vulnerable populations. Organizations of persons affected have access to what is going on the ground. So they are able to produce a detailed knowledge that government statistics will not produce. This is one. First, they are able to implement strategies for which governments lack human resources. We see that with leprosy. For instance, here in Colombia, I live in Ecuador. I'm Portuguese, but I live in Ecuador. Here in Colombia, we have a very strong organization of persons affected by leprosy, going from door to door, making diagnoses, sending people to health services, providing peer counseling. So we need to convince them by showing how much they need persons affected if they are to meet the goals with which they are compromised. Well, yeah. So regarding the question of how, here it is. Yeah, if I have any tip for ensuring that representatives of people affected by leprosy are truly representative and justify their advocacy activities with evidence. Well, I think, you know, the time for sharing testimonies was really important, because testimonies are eye-opening. They makes us see what we are not able to see on our own. But that is why I differentiate between individual advocates and collectivities. I think it's really important to strengthen collectivities, because within collectivities, people translate what is a personal experience of suffering, of barriers to participation, into a collective plan towards the towards demanding rights. So evidence, I'm not sure if this is the right word, but I think we should look into the plans and the demands that collectivities are able to produce together. Yeah, and just the question that was sent to me, go ahead, Martin.
Sorry, Alice, we have lots of other questions also coming in, but we need to break away into the breakout groups now. Okay. I think it would be very important to follow up with these questions.
Martin,
yes.
let me just say quickly, we are saving all the questions in the chat, and
yes.
and we will make sure that we find a way to address them later. Okay.
True. And I also wanted to say that those questions can also come up again in the breakaway group discussions, with a focus on really practical first steps. So maybe Russell, if you can move everybody to their respective groups randomly by MYT, and then we come back and maybe some of the questions will be answered then.
Yeah.
Thank you very much, Russell. Okay. May I assume that everybody's back by now, yeah? Yeah, I think so. So thank you so much. We had very interesting and energizing discussions in our group. I hope that is the same with all the other groups. If we kindly can ask the various groups now to report back to us, so that then later Jeff Warner from ILAB can kind of draw the conclusions of all that. So can we start with group 1, please?
Hello, you hear me?
Yes, we do. Thank you.
Sorry, I couldn't share written the main points that it was arising in our group. But let me explain you three main points that that arise and we consider interesting. About the lessons learned. For instance, Jenny Sanchez, and we could hear very clearly Jenny in this case, so unfortunately she could manage to enter very well in the working group. Jenny mentioned an experience on Chagas disease in some communities in some countries about the trainings the trainings gives an opportunity to face many of the challenges that we have in the NTDs. But the trainings to small teams, small and comprehensive teams with physicians, with health staff, with patients representatives, communities, and that worked very well in Chagas disease in some places, because it created not only to train about the disease, but also about rights, human rights, and protecting the rights of the patient. So when everybody learn at the same time and at the same level, they commit together in a better way. That is the idea that I think that Jenny shared with us. If not, I think she's here in order to clarify a little bit more about that further. A second point about an experience from leprosy in promoting the participation in the communities. There is a recommendation and a strategy to face the challenges of the human rights of leprosy patients at this moment. That is to empower the communities affected, and try to provide a legal entity when the people join together in order to face these challenges. For instance, it encouraged patient associations to become in small NGOs, because in that case it's easier to claim for resources and to have an advocacy work with more impact. And regarding challenges and strategy also, for instance, in rural areas, many times the challenges of access. Jenny said that we can do it only with the joint effort of NGOs and public authorities, because they have the resources to share with the patients, representatives, and communities in order to reach where they cannot reach. And finally, talking about the inclusion, it was very interesting, a point that was raised in the working group, and that is to internationally, there is a need to a well training and a well understanding of the word inclusion, and how and what are the steps to perform and realize that inclusion in order to be well understood. And finally, regarding the work on advocacy collectively, that is one of the challenges. There was a mention to the lack of self-confidence, like a problem in the affected communities, but also understood like an opportunity. So I don't know if I have more time, but I would like to invite the colleague that has mentioned this term of lack of confidence as a problem, but also as an opportunity, because I think it is a very interesting reflection. And because she mentioned that the strategy of working in trainings for advocacy and leadership, that is the key strategy to improve the involvement of the affected communities. But this concept of lack of confidence as a problem, but as an opportunity, I think it is very interesting. I don't know if she's in the forum at this moment to expand a little bit more on that. Finally.
Yes, I am, Javier. This is Clara. Hello, everybody. Yeah, you express it very well. We as a leprosy mission, we believe that by supporting people affected by leprosy within their own structure, so within their organization, but also among their own communities, to become self-advocate, this is one of the best way for them to express with their own voice their needs, and also for them, their family members and their own community to be able to access opportunities and as well advocate for their own entitlements and rights. And you were asking what our strategies is towards, leprosy discrimination. Definitely, this is one of the area, not the only area, but one of the area where we do focus a lot of attention, because we believe that this is one of the best way to challenge injustice. Thank you, Javier.
Thanks for the call.
Thank you to Javier and Jenny and the group 1. Maybe we can then move on to group 2. Who's reporting back there?
Gail?
Hi, this is Sophia Ribble from the International Foundation for Dermatology. I'll be reporting on behalf of Group 2.
Great.
Great. So we discussed patient advocates, looking at representation, challenges to participation, and how our organizations could help address this. A common trend that practitioners have found is that often the patient advocates in most communities are older men, although this is not consistent throughout all diseases. Sorry, I'm just feeling a bit nervous. And so we discussed how this could be overcome and what are the causes of this. Many people flagged that the issue might be due to stigma, because there's also an issue of, for instance, with leprosy, it being underdiagnosed amongst women. And so because there is a stigma around the disease, but also discrimination that people living with the conditions may face, but often there are structural challenges that women may face. So for instance, they may be less educated compared to their male counterparts. They also may not be able to travel to external events and meetings due to family obligations or cultural norms. There are discussions in terms of how to overcome this, whether providing financial reimbursement, but also just empowering community members. As one of the speakers, I think Heather Saran, sorry if I'm mispronouncing your name, noted that in some of the communities that they have dealt with, there have been very strong female advocates, but this doesn't always translate to external events. And then looking at how we can help navigate some of these challenges, some of the suggestions were that organizations can help promote more meaningful participation amongst people living with the condition, but also family and healthcare workers. So for instance, they could also work with, help improve the capacity of local partners in terms of having a better understanding of like gender equality and human rights, although the question of how to do that varied. But also another key focus was building the capacity of people affected so that they would feel more comfortable and confident to be advocates for themselves, but for their own communities. So that's just putting in place more resources and helping them establish bodies or systems or networks. But also another issue and challenge was the fact that resources are often only available in English and therefore are not accessible for all. And so there should be a focus on translating these into local or national languages. But yes, as noted earlier, participation and patient advocates vary from across diseases. I'm sure I'm missing anything out, but if there's anyone from my group, please do add anything if I have missed anything off.
That was a great summary. Thanks, Sophia.
You're very welcome. Thank you.
I think well done. Thanks to you and the group. Mathias, I hope we are not running out of time, even though we can shoot a little bit over the official timeline. I think the chat, it's opened a little longer than the official time indicated. So maybe with this, we just move on to group 3, please. And Mathias has posted, if you have any notes or your summary, then post it to Jeff or just in the general chat so that Jeff can draw on this for his conclusion. Thank you.
So it's our group, Martin?
Yes.
Group 3, please.
Yeah. So our group discussed, we had very good discussion, and we came up with 4 strong recommendations. First one is that about participation, because so far we see that some people are participating, but they really don't know what to do. So we have to do the strategic planning for capacity building of people affected by NTDs. Those who are participating, then only they can contribute effectively, and they can come up with some suggestions. So first suggestion is that recommendation is that strategic plan for capacity building of people affected by NTDs. Second suggestion is that so far that all partner NGOs are not taking serious, or I must say that, so that all NGO need to ensure that effective participation of people affected by NTDs in the NNN or national international conferences. Then only that people affected by NTDs will get that platform, and they will speak, and they can come up with their what problems, what solutions, or problem also and solution what they are facing according to their NTDs. Third recommendation is that due to COVID, now we have to find out alternatives for safe self-care and safe participation. So, so far we are talking about self-care and self-help group, but due to COVID, we have to find out some alternatives for that safe self-care and safe participation. Last and the fourth one is that we need to strengthen our networking for support each other. Like in our group, we had some example from Nigeria, and he said, I don't know where to go for simple self-care. Then another person said there is a leprosy mission hospital. So we have to develop, or we have to strengthen our networking, then we can help each other. We can suggest, or we can motivate, or we can guide them or direct them where to go. So this fourth suggestion is that we have to we need to strengthen our networking for supporting each other. Thank you so much.
Thank you very much, Suraj. I think well summarized, and with the time in mind, maybe we go just forward to on to group 4, please.
Okay. Thank you. Can you hear me? Yes. Thank you so much. I'm trying to post this in the chat box. Yes. So we discussed that some of the lessons learned are that we need to support self-organized groups and create space that they can talk for themselves. And we sometimes have the tendency to talk for other people, but and then, for example, if we know some of the authorities, then we should make an extra effort that contact that we have, that platform that we have, that we don't speak for other people, but that we use that to introduce people and to let them speak for themselves. We also talked about that there are different methods and tools for participation, and I wrote some of them down in the next and first steps. So because sometimes we think like, okay, this is the way we interact, let's just bring someone in, and maybe that's not the best way that person can interact. And then something that is important that Alice said, and that we probably need to think more about, that consultation is not the same as participation. And I have a bit more on at the challenges and obstacles, is that the terms of consultation are often determined unilaterally by the NGO or by the government agency or by whatever entity holds the most power, the most resources, etc. So And one way of overcoming this is, like, if you work with an NGO, like, try to make sure that you're not setting all the terms, that you leave room for persons affected to set the terms. Like, ask them in what context they want to have this conversation, or yeah, be open-minded. Also, what we talked in comparison, like with indigenous groups, when we have people affected by NTD, sometimes geographical dispersion makes it hard to come to collective organization and action. But sometimes local people know a way around that. Sometimes they are proactive, and we've had examples of people finding each other. And there are risks in participation. There might be political consequences, there might be violence, stigma, and so forth. And we need to proceed with caution, and we need to make sure that people feel safe to participate. So in the next or first steps, I mentioned a few things that have been mentioned: photo voice, chat box, and stepping stones. We don't have a lot of time to go into the details, but I'm sure we will get more of this information, and we can disseminate that later.
Thank you, Mathias. Thank you very much. And thanks to all of you for this very rich discussions and feedback. I was just alerted that automatically the room will close at 40. So we don't have much time. So maybe let's just move on then to Jeff Warner, CEO from iLab, for his much appreciated conclusion, and before we depart on this session. So Jeff, over to you, please.
Martin, can you hear me all right?
Yes.
All the way from New Zealand.
All the way from New Zealand, yes. Now this has been a great conversation and a great listening experience for me as well. So here's some of the things that I've listed. Will eventually find their way into reports, but I want first to look at what you've said in the chat, because that will also enhance this. I'll just take about 3 or 4 minutes, I think. Firstly, building the capacity of patient advocates and building up organisations of people affected is a long-term process. We've heard that from several people, involving intentional strategies such as identifying capable people, and then a thorough program of inclusion and building their capacity and so on, including making sure that materials are available in local languages and so forth. And as it's been said several times, this is a long-term process. It takes time. Second, it's pointed out that NGOs sometimes need their capacity built, not just to build the capacity of organisations of persons affected, but to build their own capacity to listen to persons affected by entities and see them as being in the lead. And moreover, as we've just heard, NGOs sometimes, maybe often, find themselves speaking on behalf of persons affected. If we're thinking real participation, then we are supporting or enabling them to speak for themselves and not the other way around. Then it was pointed out that when diverse or cross-sectoral teams are working and training and learning together, we need to make sure that we are not just dealing with a segment of the issues, but we are dealing with across the issues. So, for example, we might find ourselves just dealing with issues around medical or rehabilitation, but we need to focus on human rights issues in all cases. People affected, when they are joining these groups, are empowered because they're able to give expression to who they are. And related to that, we've seen that the elements of CBID, awareness, participation, twin track approaches, gender equity, empowerment, accessibility, these apply to development of groups of persons affected by NTDs just as much as they apply to persons with disabilities. And then, as just been mentioned by Mathias, knowledge and action need to be inseparable. Organisations of persons affected are on the front lines of vulnerability, and they're the ones with the most accurate reality, often more accurate than NGOs. But they may feel suspicious of the intentions of NGOs. And related to that is this reality that partnership participation is not the same as consultation. Consultation, you have to ask yourself, where is the power? Where does the power reside? With consultation, it usually resides with the party that initiated the consultation, which is probably the NGO. And the result might simply be that the agency or NGO appropriates some people's knowledge. Participation, on the other hand, is about assuring the autonomy of the person affected. And as Alice said earlier, participation must lead to action. And we heard also that action, or the expectation of action, leads to accountability or demands for accountability. Then we've heard that special attention is needed to gender equity, extra effort to hear the voices of women, because often the groups are headed by men, or if there aren't intentional strategies that women are selected as patient advocates, it's often that, and that can be due to issues like entertainment and travel restrictions and so on. We have to work extra hard to make sure that we overcome those obstacles in order to ensure that there are plenty of women's voices and plenty of patient advocates and leaders of organisations of persons affected are women. Then there's this empowering effect of being in organised groups, which a number of speakers have talked about. They become officially registered, and then they can have a much more powerful influence in terms of combating stigma and protecting the rights of persons affected by NTDs. So NGOs need to take responsibility to build up and develop the capacity of associations of persons affected by NTDs. And NGOs find that they can either create these sort of structures, as some have done, or reinforce the structures, but the important thing is that you don't own the structure as an NGO. You play your part in developing the capacity of organisations or associations of persons affected, and then stand aside because they advocate for themselves and you don't advocate for them. And this can be a long process.
Jeff, we are about to be thrown out of the room.
I think I'm just about done. So there's a couple of other sort of bits and pieces, but those are the main items, I think.
Thank you so much for kind of condensing all that. Let me just, before we are departed by technology, let me just thank all the panelists, the participants, and also our generous sponsors. And maybe the last slide could be put up by you, Gail, on that one. And may I encourage all of you and friends, when you reach out, to join the DMDI cross-cutting working group, where there is a cross-cutting group. There's a working group on human rights, on inclusion and disability participation. So please join us. And the current co-chairs are Zurich and Mathias and Zurich. So you can contact us to join the work, because clearly the very rich recommendations coming out from the presentation of the group discussion encourage us and urge us to transform knowledge into action together. So thank you so much to everybody who has participated. And with this, bye-bye to everybody. Thank you very, very much.
Thank you, Martin. Thank you, Mathias, and thank you all.
Thank you. Bye-bye. Thank you so much to all the speakers. Thank you to MIT.
Thanks, Martin.
Thanks for everyone for participating.
Thank you all.
Thank you. Thank you so much. Bye.
Thank you, Jenny.
Thank you.
Gracias.
Hopefully see you all in the cross-cutting group soon. And
Yes.
Please support the statement of commitment on participation that will be screened and adopted at the last plenary session. That's a very important step. Thank you, guys.
Indeed.
And well done, Mathias.
Thank you, guys.